I should say it's my privilege to welcome Dr. Uma for this session. This is the third session, academic session over Zoom for particularly physician assistants. But some of the topics that we choose are not just relevant to physician assistants, but it is for the healthcare and people working in the healthcare industry as a whole. This one we thought as one such one, topic, and we have invited everyone to this. And introducing Dr. Uma, I think it's my a privilege for getting to know her first, and then I think I have to read it from the text that I have here because it's so much. I don't want to miss important points over here. Dr. Uma is a professor of medical genetics and principal of the School of Allied Health Sciences at Sri Balaji Vidyapeeth, Pondicherry. She has over 25 years of experience in teaching, and this includes 2 decades at the college. And Dr. Uma is a pioneer in academic leadership. And currently, she is overseeing 18 undergraduate and 21 postgraduate programs with more than 700 students. That's too much to handle. She holds 55 copyrights and 2 patents in innovative lab instrumentation and AI-enabled nutrition apps. I think we should invite her to talk about such things in future again. And she has presented in over 250 scientific events with more than 105 publications to her name. She is recognized internationally with several awards, including from the Royal College of Physicians and Surgeons of Glasgow. And she continues to inspire as a teacher, editor, and eminent recipient of Eminent Teacher Award. Medical genetics is not just, she's not just a professor in medical genetics. She has also done, in English. So this just goes on. I've just taken the very salient points from Dr. Uma's profile, and I'm presenting to you all. Welcome, Dr. Uma. Over to you. And before that, I would just wanted to share my thoughts about this topic. Transgender, I think it's just the word that we know about, just the term transgender, and we've seen few of them on the roads or somewhere. And beyond that, I don't know how much of it we know. So this is a very sensitive topic. If someone appears to us in the hospital, how do we address them? How do we deal with them? What sort of history we will, take from them, and how do we do it? Do we have any basic facilities in the hospital to treat, and even which washroom they're going to use? All these are big questions. I think every one of us has to know about it. And what do we do when they come for a surgery, for a procedure? How sensitive we are to deal with them? All these are large, big questions looming over. And I'm sure that we're going to get answers from you through this presentation, ma'am. Over to you, please.
Yeah, thank you, ma'am. A very warm good evening to one and all. It's been a great pleasure for me to be a part of this great forum. I have to thank Gomanthi madam for inviting me. So this particular topic is, a kind of, earlier it was like a taboo, even in the college where I'm working. I joined as a professor of medical genetics and heading the genetic unit of anatomy department for the past 30 years. And in 2014, I was asked to take up transgender research. I was wondering what I'm going to do. It's very difficult for me, to go and talk. And I was just left in the lurch, what to do, how to go about it. Then I went on to do the history of these transgenders, who they are. I was not even aware at that particular time in 2014 when I started this particular transgender research, the genetic aspect, whether they are really male or whether they are really female, or is there any kind of a genetic component that is going to be different? So all this was in my mind. So I'll just first take you, we must know who the transgenders are. And is it a new kind of a history? Is it only now that is in being, we are seeing them around? Or has it been from the ancient times or the present times? And how many people have succeeded in being a transgender, themselves who they are? And then what are the things that we can do in an educational institution or in a hospital, medical educational institution, or any kind of a hospital, I'll also be able to answer many questions that if you have in your mind. So let's plunge on to the topic. It'll be like a story kind. So just stay with me. First, we need to understand who they are, and then we'll go to our part of the study. So all of us know this particular symbol, a female, and then it's a male. And the third point that you're seeing there is actually the transgender that you're actually seeing over there. Okay. So this is nothing. Who are the transgenders? It is nothing but the disorder of the gender identity. Like as out of every 100 people, one people, they cannot understand who they really are. Okay, they identify with the gender that differs from their genetic sex. We already know that if you are a male, you are a 46XY. If you are a female, you are 46XX. So the external genitalia say one thing, but the internal mind says that no, even though I'm a male, sorry, my heart says I'm a female. So that is the meaning of the disorder of the gender identity. There are two kinds of captions and word that you really need to know. One is a transgender that all of us know. The other one is a transsexuals. Who are the transgenders? Transgenders are the people who may or may not change the physical form or the social status or the legal status to match the gender that they actually feel, because they have to get one into the group, right? So they don't want, they may or may not say who they are. Transsexual are the people who actually not only feel like it, where they completely change the physical form, the social status, the legal status to feel the gender identity that they really want to show to the world. Okay. So these are transsexuals who actually, when I say they have changed themselves, actually they go in for the gender reaffirmation surgery. You can see the picture over there, a man cutting his penis and then showing it in a video. It was a self. He had videoed himself, right, to show to the world that he has been born as a male, but he always wanted to be a female. So he was just wondering why I'm having the penis. So he didn't want to live in this world. So he cut his penis, showed the world, I am now a female, and he bled to death. So these transsexuals actually have serious personal conflicts. They get into depression, and this doesn't happen at the pubertal stage, right from the preschool stage. I've interviewed more than say 200 to 300, more than that also. They always say that when they were 2 years or 3 years itself, they realize that they don't belong to the gender that external genitalia are stating as. So their frustration is so high, the anxiety is so high that many of them actually earlier were committing suicide. But the rate of suicide, which was 50% by the age of 30, now it has been brought down because, the world has come to know who they are. There are so many legal options that has been given to them. They say that the surgical options are there, and because of which they're able to change. So all this has actually brought in some kind of, a personal benefit for these transgenders. So each and every transgender, they really feel that if not me, then who I am. The external genitalia says one thing, but the internal mind says something. So this conflict keeps going on. So why a person feels male when biologically she is a female, or vice versa? It is still unclear. Scientists are actually working to solve the puzzle. And there was one transgender who came and told me, Madam, I heard you're going to do some research. I said, yes, I'm trying. I do not know what I'm going to find. She was a transgender and she was working in the library. So we at the Mahatma Gandhi Medical College in Pondicherry, actually, we are gender inclusiveness is there. So we also have transgender students, we have transgender supervisors, we have transgender teachers, we have transgender doctors who are working. So when this person came and asked me, I said, yes, I'm trying to work out. You know what? She told me, Madam, please identify while we are at home. Please, if at all you identify some kind of whatever you say, gene or something, that the person is going to become a transgender, please ask the mother to kill it. And I said, why are you saying that? Yes, madam, the suffering that we face in this world is too much. வயிற்றுல இருக்கும் போதே அதை சாவடிச்சிடுங்க மேடம். This is the statement she was telling in Tamil to me. Okay, so can we solve the puzzle while it is in the mother's womb? Well, the answer is still we do not know. So let's get into one of the story I'm here to tell. You can see the picture there. She was born a boy, but now she has transformed into a beautiful 23-year-old girl. Okay, a woman. But how could this be possible? Now we have lot of sex reassignment surgery. That was what earlier. Now the term has changed into sex reaffirmation surgery. Okay, but then who these people are? Definitely, this is a thought-provoking question. First, it's important for all of us to understand that biological sex and the gender identity are not the same. See, biological sex is nothing but the chromosome in them, the genetic makeup in them, while the physical features, whatever is associated in the human body, is the genetic makeup of an individual, right? Male has got 46XY, a female has got 46XX, the testis and penis states it's a male, the external genitalia, majora, minora, the clitoris, all this says that it is a female, right? The urethral opening, the vaginal opening. This is what a pediatrician will see while the baby is born. So when the baby is born, none of the physician assistant or associates who are working will know that it is a transgender or not. It is an internal sense of being. So the gender identity or the gender disorder or gender dysphoria actually refers to one's internal sense of being, as I told you earlier. A male may align more towards being a female or vice versa, even though the genetic makeup says something else. So the best solution for them, if they come to you in a hospital to say, I feel differently, definitely we will have the psychiatrist. We need a psychiatrist to counsel them, to make them understand. But see, after 18 years, if they say, no, I do not want this kind of a body, I look like a male, I'm sorry, the entire feeling is looking like, I feel like a female, I want to go in for a surgery. That is the time not only the doctors, the physician assistant also, we need to accept them the way we see them, right? And then we have to guide them that they can have the gender reaffirmation surgery. The surgery department, there are few colleges or the few medical institute or hospital setup where they have this male to female, kind of a surgery. Then they're called as a trans woman. And then a female to a male, which we call later as a trans man. And because of this, we can only change the external feature. Remember, we cannot change the genetic makeup. Okay, so sexual deviant humans have been mentioned since ancient times. I told you this has existed at all times and nothing is actually new in the present world scenario. Okay, so this transsexual, it has arose not only to psychological conditioning right from the childhood, it is kind of a paranoid state, of euphoria. We do not know. Okay, definitely there is some kind of a genetic disturbances also, which could make them to feel otherwise. They say that because that in X chromosome, there is a sex determining SRY gene, some mutation could make it. Then what happens to a female? We have got two X chromosome. Why more of a female also want to change it to trans men? Definitely all these queries are still not answered. So in general, sex is what we are, what a body, while gender is what the mind tells you. It is an innate sense of, personal being, whether you want to be a female or be a male. Okay, certain individuals may not align to what they have been given as with an external genitalia. Say at the age of 3 and 4 itself, they feel that they are in a wrong body. So many of them come and tell me, especially from the male, they say, I am a female. What I'm doing in a male's body? I want to change myself into a female, madam. That is why I've come to your hospital for the surgery. Okay, so everybody fondly remembers our childhood, don't we? But these trans individual, lot of internal conflict, right? The identity problem of who they are actually sends them to depression. And finally, when they come to know that they are transsexuals, are very happy. And many of them earlier, they thought of suicide. And why do they think of suicide? It is because, they act like a feminine, lot of sexual abuse. We've got a lot of bad comments from the society. because all of us, right, even including me, we never understood them. We never understood what their wants were. Frankly speaking, we really never ever wanted to understand them in any form, right? Even though they are male physically, the mannerism looks very much like feminine. Okay, such individuals have been bullied everywhere, wherever they go, whether they are in the home, whether they are there outside in the world or in the school. Whenever when they come to the hospital setup, we also know we don't actually give them importance. We shrug our shoulders. Oh, she has come. Oh, he has come. What kind of individual these people are? This is what we need to do. We must have a humane approach. Okay, this is a story of Laila who actually committed suicide. Very famous model. Okay, many individuals actually want to modify their body. They say they don't want the body in which they are living. They want to be the way they really thought to be as, okay, otherwise I really do need not live. That is a time that these people commit suicide. But once they come to know that they are actually transgenders, there are many people around the world just like them. They feel very happy, right? So they understand that, okay, let me take it up as a challenge. Let me live in this world. And what do we do as an individual? Okay, it's not only the physician assistant, every individual, we have to make them live a dignified, and we have to make them lead a normal life individual too. There are other cases in this, in India, where I had to find out, is there any famous people like this particular lady, like Padmini? She actually, went out, wanted to kill herself when she was 13, but despite a troubled childhood, she, came out of the world. She's the first transgender to take up the local TV and a career, and she succeeded. This is another woman, okay, a male who transformed into a female. Pritika, she wrote the exam and now she's a police personnel as of now. Another one, no, she's a very famous person who actually, was appointed as a principal in West Bengal in a women's college, right? And this is Lakshmi, who really, wanted to tell the world that I am a male and now I am a female. I have the right to be a female. You have scarred me with a lot of abuse when I was a child, okay? And I was molested. I was insulted. Please don't do that. Why do you call us with a lot of such name? Lot of violence is there. So she says, in my community, there are thousands of Nirbhayas. You speak about one Nirbhaya who was sexually molested and who, died. But then think of us, how badly we are being molested, how badly we are treated. We are not even given any kind of a treatment when we go to the hospital, right? All of you, without even raping us, you people are actually raping and killing us with your mental frame of mind. Please change it. This is what was her version, a male transforming into a female. You can see this particular picture. She looks so feminine, but yet she's got a beard and all that. Yes, she is supposed to be a male born, but now with her parents, she has become, a beautiful looking female. She won the hearts of millions of people, in Kerala. She actually is now a famous, jewel modeler. Okay. So now what happened to her? Very simple, right? At our medical college and another college in Chennai, we do the male to female, okay, and the female to male kind of surgery, and all these kind actually, made them to feel the way they need to feel. Okay, nothing can change. Even if you're not going to do, they go to Quakers to do the surgery. That is because none of them seem to, accept them. So did I find any answer whether they are really male or really female? Okay, I'll tell you in my research later on. So this removing of the testis and penis actually make them very happy. When it comes to a female to a male, actually mostly they do not want the breast. And 30% of them only remove their uterus. Now, this is a story that I need to tell. But male are so, very happy when the testis and penis is removed, when they have the urethral opening made. Definitely vaginoplasty is something not very much 100% okay. But then all this kind of a surgery, when they do in the medical college, the doctors do it. And we want the physician associate to be there, to accept them, to treat them like an individual, learn, because all this has become to part and parcel. You need not only stick to one particular that I will only treat a male and a female. when such kind of individual comes, the essence of your life should be to feel along with them, be along with them when such kind of surgeries are taken. Give them the confidence to feel happy to live in this world. Why I'm telling is because when we, the doctors, when the technologists, when the physician associate, when they fail not to, give them the importance, they said, whenever we go, we find all these kind of rejections where they get dejected and they go out and they, get themselves operated, in this kind of the Quakers, where you can see how badly they finally come to us begging us, please treat me like an individual. I have got it, removed, but then this is what is my condition. And then we have that, in fact, the physician assistants, we got the undergraduate, but postgraduate is physician associate as of now. No, they take care and they see that good things happen to such individuals. Okay. And other than that, we must also understand that these male, when they want to become a female, the first thing is they want the breast. So they go into a lot of, estrogen. They don't realize that if they take, while before performing the surgery, lot of, these kind of injection, they will land up in, breast cancer, or they may land up in testicular cancer, or because of the immense intake of the estrogen, they have the varicose vein, they have cardiac problem. So when these people, when they come to you, the story that you have to learn, the counseling that you need to give, definitely all the physician assistants and the associate needs to make them understand that, please, if you want, you undergo the surgery before you take in this particular, the the estrogen tablet. But now I need to tell you that many of the transgenders prefer this kind of this silicone breast implant. This kind of augmentation, prevents, all the other side effects caused by the estrogen hormone. Okay, you can see one person who dying of the testicular lump. A person died lot of estrogen, suffered cardiac failure and pulmonary thromboembolism sorrow, as well as had testicular cancer and had to die. And one thing that I need to tell here is that many people do not want, want the testis and penis removed, or sometimes the female wants hysterectomy to be, they need to do it. So at that particular time, it is up to all of us to tell them that tomorrow, see, they believed you, you're a son, they want you to give the next generation. Why don't you do it? Even if you feel that you want to change a female, please go in for your semen, you can, preserve it for the future test tube baby and all that. You can see into 77, it was a male, 84, she became a female, and then her mind changed, and once again at later year, she has become a male. So at that time, to have a baby, sperm should be there. Okay. So preservation is very important. Either it is egg or a sperm. So this is a counseling that we need to give them also. So a lot of transformation has happened over here. A male becoming a female becoming a male. Okay, this was actually done at the very early years in 1939 in Berlin. Later in Denmark, such surgeries were done. United States in 66. Thailand and Iran are the most sex reaffirming surgery that is being done over here. So in India, is it very new? Is it only found abroad? That is what earlier they said. We have a lot of transgender communities, Hijras, eunuchs, Aravani, Shiva Shaktis. Okay. But one thing is different. The eunuchs have existed in the 9th century, and actually they are not the transgenders. Forcefully, while they have been born, immediately to make them a eunuch, to be the keeper of the bed, castrated men were popular demand to guard the women quarters of the royal family. Okay, all the king, you see over there in the African countries, just to, keep the royal empire, like Cleopatra and all that, right? They had to have a male people. So they used to castrate the testis and penis. So these people are different from the transgenders, just to make them important. Okay. So this has been happening in China. It has been there in India. It has been there in Rome, Greece, and Egypt. They used to castrate men, and they are actually not the transgenders. Forceful, removal of the testis and penis to keep the royal queens, safe and sound. So let's go to the story, right? All of us know the story of Rama. While leaving the forest, while he was banished for 14 years, right, he was moving towards a forest. Then when he was about to enter the forest, he turns around and says, all the men and women kindly return back to the city. But then among the people followers, the Hijras, okay, actually they are transgenders, they did not feel bound to leave because they said that you said only male and female, we are Hijras, so transgenders, so we will stay, we will not leave you. Okay, so impressed with the loyalty, Rama sanctioned then the power to confer blessings on the people with during auspicious occasion like childbirth and marriages. So you find that people whenever we go to temple, we bow our head and we get our blessings. It is because of this, and this has been documented during the Ramayana age. Okay, so Shiva Shaktis. The another one more name is the Aravanis that we already know here in Tamil Nadu. Okay, so Naga Kanya was agreed to sacrifice to goddess Kali to ensure the victory of Pandavas in the Kurukshetra wars. So this is actually the Mahabharata story. But when Naga Kanya said, okay, I will sacrifice my life, only then the Pandavas will win, I don't mind. But one condition is there. I have not been married. I want to get married. I want to spend the last night of my life with a woman. But there was no girl who was willing to marry him, right? So, because how can a person get married to one individual is going to be dead by the next day? So, Krishna actually assumed the form of a beautiful woman called Mohini, married him, stayed to spend the night with him, and the next day he was, sacrificed to goddess Kali. So, that is why the Hijras of Tamil Nadu consider this Aravan, whom you call, and they have now called themselves the Aravanis. You see all these conditions in Kuvagam, where 1,000 gets wedded the previous day and next year they remove, okay? All these are there being described since ancient histories, okay? So what are the scientific innovation? What is the social relevance? Very simple. We need to respect the transgenders as an individual. Okay, is it the gene that is actually causing it? So I don't want to give it to say that there is some kind of a gene that goes to the brain and does not give an answer. Even though he's a male, the gene sends a radiation to the that no, you are a female. See, very simple. We have to respect them. Whether you are a physician assistant, whether you are a doctor, whether you are whatever you may be, you be, but learn to respect the transgenders. I remember asking one of the transgenders, what kind of a job you people do? He beautifully said, CSW. I was wondering, CSW, what does it mean? I know only MSW because it is a Masters in Social Worker. Madam, then no, he called me by Akka. CSW is nothing but commercial sex worker. I said, my God, lower it down. How can you say commercial sex worker? You're so proud to tell it. He said that, what I'm supposed to do? I am an individual. I am an engineering graduate. But then I have this kind of a look in me. The way I, talk really, none of them want to give me a job. So yeah, I need money. Don't you think I have a stomach to feed? So that is it. So I actually, it just, you can go, it is open. So I actually told him that, no, this is not the way you need to do. He says, if I'm an individual, I need to feed myself. So I'm a commercial sex worker. You think it is me who wanted that to be? No, it is you people who made me to do it. It is all for money. I need to live. Okay. Then I was asking another question. You are a male, only you have come now for this operation. What was it? Is it that you have, what is that? The sex. How do you do it? Very simple. Akka, it is only oral mode. Then we have to inform him. Never have it in an oral mode. If you're going to, we have to counsel them to say a lot of oral, in fact, the transgenders, 30% suffer from oral cancer because of this. Okay. And also we need to tell them that because of the cross-hormone therapy, mostly it kills them. It makes them to get into a lot of cancer. They have the cardiac anomaly. They have got the venous thromboembolism, okay, and a lot of varicose vein and surgery. So many things happen. We also can inform them that you can go for breast augmentation if at all you want it. Okay, so we also have to inform them to go in for well-trained doctors, not to get into the Quakers to do it. Also, we need to tell them, preserve the eggs and sperms so that they can go in for the test tube baby. I have to tell you here, I have a transgender student. Then it was a problem. She was very good. She was very good, very intelligent. In fact, 10th standard, she was actually a district first rank holder. And then because she always wanted to be a female, she wore chudidar. And then the parents threw her out of the house. She got into this kind of organization. And then, no, she kept, and then she did her 12th. Of course, she got some 60%. And then after the age of 21, since we were offering this kind of, education, she joined a BSc dialysis technology. Then there was a problem. Where do I actually put them? Whether she needs to go, where to, she has to go to the restroom. Then the very simple, I made the entire class. I gave a talk on transgenders to 150 students in the first batch. I told she's a part of us. She's a girl. Kindly accept her. I was very happy that the entire class accepted her as a woman. So she doesn't go to a separate toilet, but we really, because of the patients who are coming there in the hospital setup, we don't have some kind of a gender thing. We have a common toilet. Okay, it's a male toilet, we have a female toilet, and then we have another toilet that states as it's a common toilet, both men, women, transgenders, or disabled people. We have the symbol over there that anybody can go get into the toilet. So, they don't feel that they are, different, and to, differentiate them where they really need to go to toilet. So we have that kind of a facility, and education is given in such a way. We have scholarship that is given to them. We need to work on such ways to make that such transgenders educate and come out. Right, treating them with respect, treating them along with you also works out better. She got very good. She got, I think, 8.5 in her BSc, and now she has joined her MSc dialysis technology. She's completing the first year and one more year. Definitely after that, she says that she wants to join as an assistant professor in the same college. So this kind came into being is because, the entire students community, definitely there'll be some issues. We have a grievance cell, and some issues were discussed during the grievance cell. These are the things that we need to do. Some kind of innovation, some kind of a social kind of responsibility that we need to have. Okay, all this is done to an individual where, they are treated with respect. And when all my physician assistant students, they have been given a routine to work on this transgender clinic. We have it as a gender clinic. So before they go in there, we make them to understand who they are. In this kind of a thing, I would like to say that I've developed a curriculum known as a transgender healthcare curriculum. So the physician assistant students take it up as an elective, and they've learned. Now I have made the entire allied health science, all 18 BSc program to take it up as a minor paper, and all of them write this exam. We have got a syllabus done. It has been copyrighted, so that how to groom them, how to counsel them, how to what kind of surgeries are done, what are the psychological things that they face, how do we need to go along with them to treat them. Everything is there in the 5 unit, so which makes them to understand, to accept them as an individual. Okay, so all these, don't think there are only trans women. There are so many people around, like trans men. You can see the football team. All the boys that you see there were actually born as a female, and all have been converted as a male over there. Okay, so it is equal proportion. But only thing is, here in India, nobody will also see. If you see them, you will not tell she looks like a girl. Only problem is the male to female is actually seen. So, dear people who are listening to me, I would like to conclude this particular thing. It is not only that we can respect them. We can treat them as an individual. We can treat them as, the way we need to treat a male and a female. All this combination is there. And if at all you want to do a research, kindly do research on them. What kind of research? Like one of my physician assistant took up in her undergraduate, just to, as a questionnaire, to see the psychological thing. Another one more person took it up as, what kind of education they have. So we can go in also for the transgender research. This is something very new. It is you people, because you are there in every field. When they come to casualty, or when they come to the psychiatry, when they go for the surgery department, or when they have kind of an ailment, you people go into every division, okay, for the clinical posting. You can note down which is more prominent, take it up as a project, a small project, and definitely, the outcome will be very good. That is what, when you understand them, when you talk to them, you'll get more things into being. You can also, write a short project. get it done and get it published so you can get a paper in publication. So the deepest wounds cannot heal until they are expressed. So I'm requesting all the physician assistant and associate to accept all these trans people. They are not different from the general society. They are a part of the society, one of the subsect, just like the male and the female. But don't tell them it's a third gender. I was telling a third gender. Then you were saying, then who's the first gender, madam? One person not. You are telling the male is the first gender, female is a second gender. Please don't call them as a third gender. Please just call them as others. Okay, it is male, female, others. It is not only transgender. Transgender is one part of the LGBT community. All of us know that lesbians are there. Okay, we have the gay individual. Then we have this transgender individual. We have the binary, we have the non-binary, we have the queer. There is so much actually involved. It is not, I'm just giving a deviation of the transgender because these are the people you will really see to say that they're transgenders, right? You will not know a lesbian where a male having an affair with a male, all that we will not know. A female having an affair with a female. Okay, we will not come into, understanding that who they are. But transgender, we get to know them. So I'm requesting that accept them, give them their right, okay, give them the opportunities, okay, and we have a lot of law that has come even in the Indian constitution. Abroad, there are so many things which accept them, right? So once a transgender said that the rainbow is shining bright and beautiful, I see hope. So let's all join hands in making their hopes come true. With this, I thank one and all for having listened to me. With all these references, I thank one and all. Thank you.
If there are any questions to Dr. Uma, please put it up in the chat. I'll read it up to her. Ma'am, thank you very much for this wonderful talk. This 1 in 100, the statistics.
Yes, ma'am.
It's really shocked. I thought the prevalence will not be that much, but how did even the statistics come up? That itself would have been very difficult, right?
Ma'am, this statistics has been taken in 2011, right, ma'am? And they have not done the statistics once again. The scenario is even more higher. They say 1 in every 60 or 68 that has come up around the world. In India, we are yet to find, ma'am.
Yes, that also may not be correct, ma'am. It must be an underestimate.
Yes, ma'am.
Because a lot of people may not come out with, even if in a survey. It's really shocking to know that, and how much of them will be suffering in silence.
Yes, ma'am.
That is the case. Yeah, and what about the larger healthcare group, ma'am? Is there anything in? I don't remember seeing anything in the registration form. I've come out of clinical medicine and I'm into research, but when a patient comes in and registers a form, is there any space for them?
Yes, ma'am. Like we have that male, female, and we have others. Done in all our college, but many college do not do that, and the medical forum that is not there. This has to be addressed. Yeah, actually, I remember seeing one in Anna University. They've written male, female, and transgenders. But actually, that word transgender should not come, madam, because there are other, because they like LGBT community is there. So we have to have the word others over there, ma'am.
Correct. They'll be leaving a whole lot of other community in that.
Yeah.
Ma'am, this difference between transgender and transsexual itself is a new thing that we are listening to. And what about this? If gender identity is an internal issue, it's an internal disorder.
Yes.
Gender identity disorder. What about the secondary sexual characteristics that they get, ma'am? Especially for men.
The intersex, ma'am. The intersex.
No, secondary sexual characteristics like development of breasts and female development of body hair and facial hair and all that.
Yes, ma'am.
Is there any, is it hormone related? If it is not genetic?
Ma'am, no, ma'am. These, you're talking about normal male who wants to become a female, how he is getting the breast?
Not the intention, even before that, before seeking the help.
Yeah.
So we
ma'am, actually, no, ma'am, they are normal individual. They have the mustache and all that, and they take this estrogen. Mainly, if they take the estrogen, they get the breast development, and it is not everybody gets it. It's not easy, ma'am, frankly speaking.
Okay.
If they take the estrogen, madam, they take 2 mg or 3 mg of estradiol and all that. They get a lot of vomiting and all that. So it becomes very difficult for them. It's not that all male, if they have the injection, they'll get the breast development. It is very minimal and all that. And many of them fail to take it further because, lot of other side effects that they have. So actually, the mustache and all, falling off hair and all, ma'am, it is purely, that is, they go in for the facial, they shave it and then they say they remove it by tweezer and all that. And definitely the sound of the voice, it cannot be changed and all that. Everything is there, madam. So that is why we tell that don't go in for the estrogen, because lot of complications are there. You get your sex affirmation surgery done and then we suggest. But the best thing, they go in for the sex, the breast augmentation right now. The silicone gel, that is, because they want to look like a female. That is a major thing. They want to have a breast. When we talk to them, madam, it is, something else, why they want so much, why they need to suffer. Frankly, they suffer a lot, ma'am, with all this kind, not only psychological.
It is really bothering, ma'am. It's very disturbing. And also the case study that you showed of somebody mutilating himself and, bleeding to death. I don't know if I can, after hearing this, whether I should refer him or her. So that is the, uncertainty that we have. We have to have, practice on how to refer them. And how do they want to be referred to, ma'am, when they're coming? So your hospital is actually dealing with such cases. Surgeries are going on. What about the non? Because we work in every other, specialty, general medicine, everywhere. So if we get a patient who's a transgender, how do we deal with them? What kind of a sensitive questions that we can ask, we cannot ask? Because in history taking, if it's a female, we'll go ahead with asking for what the questions are about the menstrual period and all that. I'm sure that that's not going to be the question there. But what are the sensitive questions that we should avoid and we should ask, which is going to which will have medical implications? There are some questions that we should ask, even if it's uncomfortable. And there are some questions that we should avoid. Do you have any advice on that?
Ma'am, frankly speaking, ma'am, I told you I've spoken to so many people. One thing I realized, especially I've spoken more to males only. Actually, madam, a female doctor, a female physician assistant, associate, talking to these male works out even more better. Okay, ma'am. Why? Because, they identify me along with them. They say that, sir, they say me, Akka or Amma, the way I feel, no, because you're a lady. So that works. And actually, ma'am, you have to have that humane touch. Very simple. You can ask them any kind of question, madam, they will be willing to answer. You can take it from me. Any kind of question. Only thing is, if it is a trans, a man changing into a female, if a female talks, they're even more happier. Because they feel that, that's what they tell me, that Amma, you understand me better. You are a woman, no, you understand my feeling. They come to that kind. And then when you call, you must not use, like male words. Like I cannot say, okay, da. Okay. I have to say, I cannot say, I cannot say Kanna. I have to say Kannamma. Or I have to say, okay, Appadiyamma. If we use such kind of a words, make her feel very womanly, they are ready to answer. So as of now, madam, there is nothing like delicate question. I have asked them, what kind of a job? They said they're CSW. Then as I said, commercial sex worker, don't you think it is wrong? No, you have to ask in a very soft tone. They will able to answer you everything. Even they told me how they have sex with, especially the policeman only harass them, ma'am. Out. Okay, ma'am. Right from that story, if I'm able to hear without any kind of thing, is because the approach that, maybe, I'm a bit older and that is also there. Even younger people, if you call them Akka, if they've got young girls only going, that works out even more better, ma'am. So I feel
we address patients by name. But of course, when you speak in vernacular, some words like this will come up. Padangama, something like that, you obviously tend to use such words.
Yes.
Anyway.
So that's what we have to be very cautious when we use it. That's what we have to treat them, because they've come for a female kind. So if you use the word ma or akka and all that, they're very, very happy. That is it. These are the few clues that I can give it, so that they will also understand. Or you can make it very, in English, it becomes very, it will lie down and all that. When it comes to Tamil or any kind of a vernacular language, they have to use this kind of a feminine kind of a tone to them. It works out better, ma'am.
There's no such thing as sensitive questions for them. They are happy to answer.
Yes, ma'am. Yes, ma'am.
And in the chat, I could only see thank you messages, but Dr. Blessy is asking again about the side effects of the surgeries, of about hormone therapies and complications. She wants some reiteration about it.
Ma'am, actually, when the people come here, I'll tell you in the medical college here, when people come, we tell them that they have to stop any kind of a hormonal therapy, cross hormone therapy that they are having 6 weeks before the surgery, ma'am. And before they come 1 week earlier. So we take their blood sample, we identify the hormonal level also to identify it. But definitely it will cause a lot of complication if they really, still continue with their estrogen thing. That is it, ma'am. And after that 1 week time, we usually take them to be there, because we have got all legal procedures, because they should be above 18 years. We've got the legal opinion, we've got the affidavit done. But now they say even without anything, if they're 18, they can go. But we have all these process, ma'am. We have got a legal person who sits. We have the affidavit done. We get their sign. But usually the parents, they will never come. So we have these kind of, organization where one person who's called that Deva Amma, that person signs for that particular individual. So with all this through, as of now, madam, almost 90 to 95% have left without any kind of a complication. We are very happy with it, because we have got a follow-up and all that. And 90 to 95%, madam, there's no great complication. There are few complications of people who are coming about 35 to 40 because of the diabetic problem and all that. They, in that euphoria state that everything is changed, they enjoy with a lot of sweets and all, then they come back. Otherwise, complications for a male to a female has worked out very well. But a female to a male, breast reduction surgery, beautifully done, madam. And, they look 100% like a male. But among that, only 30% have come back for the total hysterectomy. I do not know why. So, and these people, they take testosterone. It works out better. They have mustache and all that. Complications are there. But if they, each and every individual is addressed, there's a protocol available, madam. If we address them, that finally follow the procedure, maybe then, no, ma'am, there's not much complication.
How much does it cost, ma'am, sex reaffirmation surgery?
Ma'am, as of now, I think it is coming around to 80, ma'am. It is been 80,000 only.
Are there any governmental support?
Yes, ma'am. They have a government support also, ma'am. Actually, now it has already come, all the surgical material, everything. We've got the insurance claim also, ma'am. It is there even in Tamil Nadu. And so it comes out, they need to pay some 20 to 25,000 only because of the stay in the bed and other things. I think more than 50,000 is funded, ma'am.
So what is now needed is awareness, I think. Even
yes, ma'am, awareness.
Healthcare,
that is it, ma'am.
If they, happen to chance upon such a person.
Yes.
And which are the other places that they are doing here, ma'am? All government hospitals take up this.
Yes, ma'am. There are few government institute hospitals also that has been taken up. They are doing it, ma'am. It has become like, there are one or two individuals in all the hospital who really take it up and they're working, especially male to female is now become very easy, ma'am. Very easy, and giving them personal satisfaction. You can see the picture there. The outcome is very much like a female.
Okay.
In our college, we're doing mostly male to female. In Satya Sai Medical College in Chennai, we are doing female to male, ma'am.
Great. I think we've come to the end of it. I should thank you, ma'am. Thank you very much for giving your time for this.
Yes, ma'am.
And if there are any more questions that is coming up after this session.
Yes, ma'am, because very delicate, nobody will be asking questions.
I know if it is so delicate for people who are, participating in this, I can imagine how it will be for the people who are suffering with this.
Yes.
So thank you very much for your time. A lovely session. This will be coming up on YouTube after some time.
Yes, ma'am.
And it's all again appreciation chats only. No more question, ma'am.
Okay, ma'am.
Thank you very much.
I'm very happy. I have to actually thank you, ma'am, because not many people would like this kind of a talk. But you really thought that, because it is not I'm advocating transgenders and all that, ma'am, because I was involved. And I really thought that this
very
really
basic
needs.
things also we don't know.
Ma'am?
And very basic things about this also we are not aware.
Yes, ma'am.
And it is, it's not in the curriculum, as you see.
Yes.
So it's so we will be continuing like this if we don't listen to such talks.
Definitely, ma'am.
Thank you. Thank you very much, ma'am. Thank you.
Yes, ma'am. Thank you, ma'am. Thank you so much.
Thank you.
Thanks to all the people who have listened to me. Thank you, ma'am.